Good morning, everyone. So, we will be discussing speech and language disorder. So, what is speech and language disorder? It is a communication disorder such as stuttering, impaired articulation, language impairment, or a voice impairment that adversely affect a child's educational performance, which means the child has difficulty pronouncing a word or making a sentence, or will he or she will always stutter. So the development of the study, the earliest work related to speech and language disorder was nearly 2 centuries ago. It focused on how these individuals should communicate using voice or sign language. Soon, professionals expanded their interest to the need of individuals who has this kind of impairment. So the emergence of profession. A new group of professionals was emerging to address speech and language disorder. The first formal program for speech and language pathologists were not established until the 1930s. In 1925, ASHA, or American Speech Language Hearing Association, began, and now the professional organizations that set the standards for their professional practice. In the early 20th century, most intervention for children with speech or language disorder took place in public schools. Instructions were also emphasized, and the study of speech and language disorder were influenced by many same forces that shaped the field. So the concept to describe speech and language disorder. Speech and language disorder refers to problems in communication and related areas such as oral motor function. These delays and disorder range from simple sound substitutions to the inability to understand or use language or use the oral mechanism for professional speech and feeding. So communication is the exchange of information between the sender and the receiver.
Elements of language. Language is the system of symbols governed by complex rules that individuals use for communication, and it is based on their culture, and it consists of five elements. The five elements are the phonology, morphology, syntax, semantics, and pragmatics. Phonology is the ability to hear, discriminate among, and use the sounds of language correctly. Morphology is the ability to combine sounds to make the smallest units of meaning in a language, whether words, test, they, or breathe. Syntax. Every language has a set of rules that determine the order in which words are used. The ability to recognize and follow those rules is called syntax. Semantics. Ability to understand and use language precisely. Pragmatics. Use of language within social context. Each has a pragmatics. Students speak differently to peers versus adults. Language disorder. Students with language disorder may have significant and chronic problems related to any one of the discrete components outlined, or they may be disabilities that encompass several of these components. When the students have language disorder that cannot be explained by other disabilities, they are referred to as having a specific language impairments. Milestone in the development of children's speech and language. 1 year old recognizes name, says 2 to 3 words in addition to mama and dada. Understands simple instruction and recognizes words as symbol for objects like meow for cat. 1 to 2 years old understands no, uses 10 to 20 words including names. Combine 2 words, make the sounds of familiar animals and waves goodbyes, and plays some games. 2 to 3 years old identify body parts, can identify body parts, uses two negative phrases like no one, and I don't want. Understand can understand simple time concept like last night, solves problems by talking, matches 3 or 4 colors, and knows big and little. 3 to 4 years old can tell a story, has a vocabulary of nearly 1,000 words, understand yesterday and summertime, and also lunchtime. Begins to obey requests and knows last name and home street name. 4 to 5 years old uses tense correctly, has a vocabulary of nearly 1,500 words, identifies shapes like circle, triangle, and squares. Can speak of imaginary condition like I hope, I wish, and can ask many questions including why and what. 5 to 6 years old has a vocabulary of about 2,000 words, knows special relation, knows address, can distinguish left and right without assistance, and uses all types of sentences. Recognizing language disorder. Receptive language disorder behaviors is you can see that they can respond inconsistently to sounds or speech, has a short attention span for things he/she likes to do, sometimes look blank when spoken to, seems to have difficulty understanding abstract concepts, seems to be distracted by extraneous sounds when spoken to. Expressive language problem. Seems unusually quiet, does not contribute to class discussion, often uses words incorrectly, sometimes uses words incorrect or order of sentences, seems lethargic and unanimated when talking. As you can see here, this is the human structure for speech production. The nasal cavity, hard palate, tongue, epiglottis, larynx, trachea, soft palate, and esophagus. These body parts are the human structure uses for speech production.
Recognizing language disorders. Many school professionals wonders if a student apparent difficulties in the classroom, lunchroom, gym, or playground could be a symptoms of language disorders. So here are some behavior that might signal the need to ask input from a speech or language pathologist. Receptive language problem behaviors. Here are the behaviors. First, responds inconsistently to sounds or speech, has a short attention span for things that he or she likes to do, sometimes looks blank when spoken to, seems to have difficulty understanding abstract concepts, seems to be distracted by extraneous sounds when they is spoken to, has problems with multiple word meanings, has difficulty recognizing relationship of words to ideas, has difficulty using phonics as a method of recognizing words, has difficulty sequencing events, day of the week, numbers, and etc. Generally repeats question rather than responding to it. And lastly, tend to shadow question or self-vocalized or repeats them. Expressive language problems. Here are the symptoms. Seems unusually quiet, does not contribute to the class discussions, often uses words incorrectly, sometimes uses words in incorrect order in sentences, seems lethargic and unanimated when talking, uses more physical behavior than verbal expression, cannot find descriptive words in conversation and writing, uses short sentence most of the time, rumbles when telling a story or responding to questions, uses an excessive number of ums, pauses, and repetitions, overuses words that define concrete ideas, talks excessively without making him herself understood, fails to recognize cues indicating that he or she should stop talking, and lastly, an excessive inability to remember. Students who have difficulty finding correct words or understanding the nuance of language, like for example, not understanding the expression, such as it's raining cats and dogs, they have the problems with semantics. Finally, some students experience difficulty participating in the social aspect of communication. They might monopolize the conversation, unaware that others would like to speak as well, or they might start talking about topics unrelated to the one that is being discussed, causing peers or adults to look at them questioningly. There are issues related to pragmatics. Many language disorders cannot be characterized based on a single dimension. There are some examples of language disorders that have several components. Some students acquire language at a rate slower than atypical. This is referred to as a language delay. Some of the students eventually will catch up, and their language skills will be comparable to those of their peers. Others may be always tag behind, but they may continue to make progress. For a few students, the delay can be significant, and the students do not progress. Early intervention, the topic is introduced later in this chapter, and is particularly helpful for students with language delays. Aphasia refers to any language impairment that is caused by brain damage. Although it is more common in adults, children can become aphasic as a result of a brain injury, an injury that occurs during birth, or a tumor. Aphasia includes difficulty in using language receptively or expressively, and it can range from mild to severe. Examples include difficulty in recalling the words that describe common objects, example chair or glass, and forming sentences, and listening and reading with understanding. In order to use speech and language, the ears and the related structures and the brain must take in and interpret auditory information. Students who have central auditory processing disorders, or CAPD, do not have hearing loss, but for some reason, their brains do not effectively interpret the auditory information that comes from the ears. They may have difficulty in several related areas, including listening and speaking, using the rules of the language. The elements of speech. Speech is the use of the oral channel for exchanging information and knowledge. Hundreds of muscles and structures can be involved in speech, and some of these are highlighted in figure 9.3. First, breath has to be expelled from the lungs using the muscle of the ribcage and the diaphragm. This air has to be forced through the larynx, also called the voice box, that includes structures and muscles and the neck. Here, the muscles control the amount of air flowing out at one time, causing the vocal folds, also called vocal cords, to vibrate in order to produce sounds. Professional singers provide an example of how important this part of speech production can be. They have learned to precisely control these muscles so that they can make exactly the correct pitch at exactly the correct loudness rather. Finally, the structures and muscles in the head, including the lips, jaws, tongue, teeth, and soft palate, provide for the fine-tuning of speech. Think about what you do to form the highlighted sounds in this word. Band, pant. You rely mostly on your lips to form the sounds correctly. Here is another example. Say these words. This, think. These sounds require touching the tip of the tongue to the upper teeth. If you have ever been to the dentist for work that involved numbing your mouth, you know exactly how much clear speech relies on controlling your lips, teeth, and tongue. Speech has these dimensions: voiced, resonance, articulation, and fluency. The voice includes three components. Number one, pitch. It is the highness or lowness of the sound. The second, the intensity or loudness. Loudness is the perceived volume of speech. And number three, quality, that concerns the extent to which the speech would be characterized as smooth or hoarse. Spoken language requires voiced, but voice is also used for laughter, singing, and crying. The air exhaled from the lungs may be voiced by the vibration of the vocal folds within the larynx. In contrast, whispered sounds are not voiced, nor are a few speech sounds such as p, th, and k. The nasal or oral aspects of spoken sound is called resonance, and it sometimes is considered part of voiced. Some people have rich and full voiced, but others have voices that might be considered weak and ready. Of all the dimensions of speech, school professionals often are most familiar with articulation. Articulation involves the movement of the tongue, teeth, lips, and palate to produce the sounds of the language. In the example given previously, bond, pond, this, and think, it is articulation skills that enable a person to correctly see each words. It is not enough to be able to voice the sounds of your language. Fluency refers to the ability to speak without hesitations that interfere with clear communication. Children are considered fluent when they can produce speech smoothly, when they can make words, sentences, and paragraphs that follow the cadence of English, which poses for taking breaths. Working with students with central auditory processing disorder. Central auditory processing disorder, or CAPD, is a disorder that involves the ability of the brain to interpret the auditory message that it receives from the air, but it is not caused by hearing loss. Although specialized testing is needed to determine whether CAPD exists, these are some characteristics of students with these disorders. First, talks are like the television louder than normal, interprets words literally, often need information repeated, ask many questions, or often obtain information, confuses similar sounding words, develops speech and language skills late, experiences difficulty memorizing, hears better when watching the speaker, and lastly, has difficulty understanding rapidly spoken speech. So, as an educator, you can help students with CAPD by attending to many small details related to the classroom environment. Here are some suggestions for assisting students with CAPD. First, seat the student close to you or any other speaker away from distracting noises. Use printed materials and manipulative to supplement oral instruction. Teach students to visualize. Teach them memory tricks. Avoid repetitive drill such as flashcards. Role play with students how to interact with others in various social situations. Show rather than explain. After other students begin their work, check to be sure that these students understood the direction. Speech disorders. Just as with language disorders, students who have speech disorders may have problems in any of the four components: the voice, resonance, articulation, or fluency of speech, or in a combination of them. Voice disorders occurs when students have difficulty with pitch, intensity, vocal quality, or resonance. For example, Evelyn is a student with a voice disorder. When she speaks, she reads very shallowly and her voice seldom reaches above a whisper. Brittany also has voice disorder. If you heard her speak, you would describe her voice as having a harsh, rough quality. Jude's voice is muffled. He sounds as though he has a cold even when he does not. Some voice disorders are caused by physical disability, such as cleft lip and palate, that is discussed later in this chapter. Many young children experience articulation disorders, including omissions, substitutions, or additions. Distortions are yet another articulation disorder. They occur when a sound not found in a child's language that is used for another sound. For example, if soup was said with air escaping from the side of the mouth, a distortion would have occurred. These errors are considered disorders only when they persist beyond the typical developed beginning mental period. Another fluency disorder is called cluttering. Cluttering occurs when an individual speaks in bursts or pauses in unexpected pauses during speech. The rhythm of speech may be described as jerky when person clutters, and that person may not be aware that this is a problem. So, interacting with students who stutter. More than anything, students who stutter needs a communication environment that is supportive. Professionals can help by following these guidelines. First, try to find a quiet time to share language with the students. Avoid temptation to fill in words or finish sentences for a student. Maintain eye contact and wait patiently until the student finishes speaking. Give the students your full attention. Model relaxed and hurried speech for students in the class. Avoid giving advice that is not helpful. Example includes slow down, relax, and take a deep breath. Practice all the skills that you have learned for being an effective listener. Teach speaking manners to all students. Do not allow students to interrupt, speak for others, or finish the words for them. If reading aloud is necessary, have students read in unison in a small group. Gradually, reduce the group size until the students is reading one-to-one with a naturally slow reader. Eventually, The other readers can begin to remain silent for every other words, that then for more words. Do not force the students to talk or to perform tasks orally. For example, reading in front of a group. Provide successful group speaking experience for all students. In addition to choral responding, many students who stutter are far more fluent when they sing. And lastly, stay in touch with a speech language pathologist and ask for additional ideas for day-to-day communication and for situations in which problems have occurred. So next, an example of a particularly complex speech disorder is called aprasia of speech. These disorders exist when individuals have extraordinary difficulty in producing speech that other people manage easily. When children have this disorder, it is called childhood aprasia of speech. No matter how hard they try, these students cannot put together the movement and pattern required to speak. Their lips, tongue, and other speech mechanism seems to be unable to do what the brain is telling them to do. They usually understand language very well. The disorder is one of expression. As a result of aphasia of speech, some students' words are unintelligible. Many students with this disorder speaks as little as possible, and so they often are perceived as being shy or quiet. Some with peers and adults may perceive them as lazy or unmotivated. Others sometimes mistakenly assume that they lack ability to achieve.
Mastery of speech sounds. Sounds typically mastered may vary to a student's age. 2 years old, PHNBK. 3 years old, MWGFD. 4 years old, T, Sh, J, and Y. 5 years old, SV, Nong, R, L, G, Z, I. 6 years old, B, T and tin, T in da, and Z and measure. 8 years old, consonant blends in cluster. So there are causes of speech and language disorder. Speech and language disorder are caused by many different factors, and the following are the most common causes. Biological causes. It may be the result of problems related to the central nervous system or to the structure and functioning of other systems within the body. For example, many individuals who have mental retardation also have speech and language disorders, and mental retardation is considered a biological cause of these disabilities. Emotional disabilities can also cause speech and language disorder. It might be also a congenital that are present at birth as a result of known and or unknown cause. An example of congenital disorder is cleft lip in cleft palate or maun siyang gitawag nga mga sungi or mga bungi. So cleft lip, it is described having a separation between the two sides of the lip that often also involves the upper jaw. While cleft palate is there an opening exists in the roof of the mouth. Environmental causes. Some disorder occur because of repeated ear infections that interfere with hearing and eventually affect speech and language development, or might be a neglect or abuse. Perhaps the child is left alone much of the time without peer or adult language models. Alternatively, perhaps the child is punished for being naughty or for talking as toddler. In either case, a negative impact on speech and language development is likely. It might be also of abusing the voice like screaming or shouting that might be cause problems that lead to
hoarseness, or an inability to speak loudly enough. And also, those children who live in poverty are more likely to be prone of this disorder because of malnutrition that may lead to a brain damage. So, what are the characteristics of individuals with speech and language disorder? Students who have speech and language disorder are a diverse group. However, some of the most common cognitive and academic, social and emotional, and behavior characteristics are outlined. Cognitive and academic characteristic. No generalization can be made concerning the cognitive characteristic. They may be academically gifted or may be average or may be struggling to learn and understand. But most of the students who have mental retardation also have a speech and language disorder. Academic characteristic. Although the academic achievement of some students with speech and language disorder is comparable to that of their peers, this disorder often have a profound impact on students' ability to learn. Speech and language disorder and reading. So most of the research on the influence of speech and language disorder on students' learning focus in reading, and the available information is sobering. So, children who have significant speech or language delay are at high risk of experiencing reading difficulties, and almost 83% of the kindergarten with disorder are qualified for remedial. Social and emotional characteristic. Many students with speech and language disorder struggle socially and emotionally because of peer teasing. They are afraid to be mistaken in front of others and ashamed if they did mispronounce something, and they need assistance in maintaining positive views of themselves. Behavior characteristic. Young children who cannot explain their needs in words sometimes resort to inappropriate behavior, as an example of a toddler who bites a playmate in order to get a desired toy. So, researchers found that the intensity of learning disability for students with emotional and behavior disability increased as the students got older. Speech and language disorder and other disabilities. So I have already tackled about the term comorbidity, which it is refers to the simultaneous existence of two or more disability. For example, is the one I mentioned earlier, which is mental retardation can be the reason of speech and language disorder. So no programs and services for these students can be effectively used unless they are designed to address the multidimensional nature of the students' disabilities. So, how do learners with speech and language disorder receive their education? Speech and language disorder students receive their education in the setting most appropriate for them based on their special needs. If speech and language disorder is the primary disability, its emphasis is placed on providing services and general education with peers. While if other disability also exists, the team will make the decision about the placement. Early intervention. So, the most critical time in life for speech and language development is early childhood, and much is known about typical speech and language development and problem that can occur for very young children. And nearly 600,000 children ages from 3 to 5 receive special education services through IDEA, and more than 330,000 are identified as the speech and language disorder are the primary disability.
Importance of early intervention. The importance of early intervention. It is crucial in the early years of a child's developmental stages as it can minimize the effects of young children who are at risk or diagnosed with such developmental disabilities. It is essential in the child's life, and it is also critical that families seek early intervention programs that will make all the difference in the child's future. Recommended educational practices for students with speech and language disorder. Speech and language services and literacy information. Speech and language services can help children become effective communicators, problem solvers, and decision makers because it allows them to benefit from a more successful and satisfying educational experiences as well as improve their peer relationship. Communication skills are the foundation of academic and social performance. The ability to participate in active and interactive communication with peers and adults on the educational setting, it is essential for students' success in schools. Problems with speech or language development can lead to difficulties learning to speak, listen, read, or write. As a result, children with communication disorder may perform at a poor, insufficient academic level, struggle with reading, have difficulties understanding and expressing language, misunderstood social cues, avoid attending school. Okay, so the next thing that we have here is communication using technology. The use of technology in special education helps break the barriers for people with disabilities and provide the access to the most relevant educational programs. Properly designed software and hardwares allows the students with special needs to get modern education and advance the required information online. Implementation of technologies in special education allows simplifying the communication and improve the academic skills of students with disabilities. Okay, so the next one is argumentative and alternative communication, or it is AAC. Okay, ACC are communication devices, systems, strategies, and tools that replace or support the natural speech. These tools support a person who has difficulties communicating using the speech. Argumentative communication, it is when you argument something, you add it or supplement. It is when you add something to speech. Example, it is a sign language, pictures, or a letterboard. The next one is alternative communication. This is when you are not able to speak. It is also when your speech is not understood by the others. In this case, you need a different way to communicate. These tools help a person communicate when they cannot rely on speech. Perhaps your child has not started talking, perhaps you have lost your ability to speak, and perhaps your speech came and go. Maybe speaking is harder than other ways to communicate. So AAC can help. Okay, so the next is technology for language practices. The common traditional classroom model of lecturing is the note-taking and completing worksheets causes problems for many students. Within this model, those with learning disabilities or speech language impairments may find difficulty writing down what they hear, struggle with poor handwriting, or find that they simply cannot keep up with the pace of the class. Modern technology devices such as computers, tablets, software, and games allow students to approach lessons differently. These devices cater to a variety of learning styles and abilities. Students who struggle in the traditional classroom may find their education to be more productive with the aid of technology. For example, a student can read along while listening to an audio version of a text on a tablet. A student with dyslexia may benefit from text-audio matching exercises, or a child who has difficulty holding a pencil may find typing on a computer or tablet to be an easier alternative. Okay, so moving forward, the next one that we will tackle about is perspective of family and parents. Family members have important information about their children, and this information is valuable to anyone involved in a child's care. Parents and guardians have a special understanding of their children's unique qualities and characteristics, such as temperament, strengths, and interest. Their perspective adds important information for teachers and other professionals to consider. The way family members view their child's disability or other special need is also an important factor for child care providers when they are building relationships with families. For example, a family may give reasons for a child's disability or special need based on their own cultural family experience. Okay, so the last one is trends and issues affecting the field of speech and language disorder. Okay, so the first one, it is language differences. A language is a tool of communication, while communication is the process of transferring message to one another. Language focuses on the signs, symbols, and words, while communication lays emphasis on the message. So a language difference is having the ability to speak another language that is different from the language used for instruction or used by the majority for people. Language differences are not an indication of language disorder. Okay, so the next one is other cultural influences on communication. Past experience, perception, and cultural background greatly affect the way people talk and behave. Communication and culture reciprocally influence each other. The culture in which individuals are socialized influences the way they communicate, and the way individuals communicate can change the culture. Okay, so the last one is this Central Auditory Processing Disorder, or this CAPD. The auditory processing disorder is a hearing problem that affects about 3% to 5% of school-aged children. Kids with this condition, also known as Central Auditory Processing Disorder, or the CAPD, can't understand what they hear in the same way other kids do. This is because their ears and brain don't fully coordinate, just like this one.